My name is Ana Jimenez. I'm gonna learn professional English in use 14, unit 14 to 24. And the first exercise is 14.1. Complete the table with words from C opposite. Put a stress mark in front of the stressed syllable in each word. The first one has been done for you. Um, exhausted, fatigue, fatiguing, lethargic, tidiness, tired. The second exercise is 14.2. Make word combination using that word from each both. Look at A, B, and C opposite to help you. Complain is of complain. Of colors. Out of is source. But on worth but no out. Complete the sentence. This 14.3. Complete the sentence with the correct form of the verb present. A 67 years old man presenting with a 9-month history increasing shortness of breath. The most common presentation is a loss of consciousness. Cranial arthritis may present a fever without any obvious cause. The patient usually presenting with a severe sore throat. The presenting symptom in this patient could perhaps be due to renal failure. Other conditions with similar presenting include acute cholecystitis. Reduced growing is an important presenting complaint of celiac disease. 2 months following presentation, the patient was able to walk. For exercises 14.4. Read the patient description of her symptoms, their complete the case report. Look at the opposite to help you. It was well until a few months ago. In the beginning, is you felt of color and act bit tired. But lately, it's been feeling completely worth out. At the end of the day, I am not eating any more than usual, but I've put on 9 kg in the last year. My motions are hard and my hair has started to fall off. Case 30. 50 years old housewives who have been well until 4 months previously. Complete on tidiness and where sorry migraine. She has gained 9 kg in weight in the year before she presented to her GP. Although she denied eating more than usual, she was constipated and she noticed that her hair had started to fall off. Now I'm gonna read the exercise of fighting. Fighting, fighting for fighting point 1. Find word in the box with opposite to meanings. Look at B and C opposite to help you. Adequate, inadequate. Against, sorry. Rare. severe, likely, unlikely, likely, common, rare, mild, sudden, severe, insidious. I'm gonna read now the exercise 15.2. Make word combination using a word from each book. Look at B and C opposite to help you. Bone, marrow, differential, diagnosis, insidious, onset, senses, progress, senses, vibration, iron deficiency, pernicious, anemia, progressively increasing. Now I'm gonna read the exercise 15.3. Complete the sentence. Look at A, B, and C opposite to help you. 39 years old man presented with a history of progressive abdominal distension over a period of 6 months. Blindness might be caused by vitamin A deficiencies. The blending and purpura are caused by a normal platelet function. The white cell count is normal, so we can exclude acute leukemia. The yellow colors of her skin are conjunctiva, is probably due to jaundice. There's a palpable mass in the right upper quadrant of the abdomen. Treatment is augmenting and restoring fluid balance with adequate intravenous fluid. The anemia may be due to increased red cell breakdown. I'm gonna read the exercise 50.4. Complete the conversation. Look at C opposite to help you. Professor, what is against to the diagnosis of pernicious anemia or physical examination? Student, the problem started with quite subtly. So I didn't have the typical insidious onset. He does have any skin color and he does have symmetrical paresthesia or accent, vibration sense. And I could feel his spleen. What is about his tongue? His tongue was normal, at no inflamed or sore. Now I'm gonna read the exercise 16.1. Label the diagram using word from the box. Look at A opposite to help you. In the head is called jawbone, and breastbone, rib, collarbone, shoulder blade, spine, C-bone, kneecap, shin bone. Now I'm gonna read the exercise 16.1.2. Mark the types of fracture with the description. Look at B and opposite to help you. 1, open. There is a break in the skin. Commitment. There is the bone is broken into the several pieces. Displaced. There's broken pieces are separate. Green stick. The bone is bad. It occurs mainly in children. Impatient. The broken pieces are punched together. Now I'm gonna read the exercise 16.3. Complete the textbook extract. Look at the opposite to help you. The reducing a fracture involves trying to return the bones to as near to their original position as possible. If a fracture is allowed to heal in a displaced position, the fracture will unit, but it may go out to minimum. Now I'm gonna read the exercise 17.1. Complete the table with word from A and B, A and C opposite to help you. The complete A and C opposite. They complete the sentence with a word from the table. Delay, delayed, develop, develop, developing, developing, adjective. Distant, distation, distendant. Failure, failing. Nourish, nourishment, nourished. Um, Continuing the chapter, the baby with the fetal alcohol syndrome may present in the failure to thrive. Abdominal distension may be due to a large liver. A small amounts of alcohol in pregnancy can affect fetal development. Mortality from measles can be reduced by better nutrition. Delay in one or more of the milestones may be the first sign of disease. I'm gonna read the exercise 17.2. Complete the sentence. Look at A and C opposite to help you. After sitting, babies learn to crawl and then to walk. A child who has started eating solid food has been warned. Someone who is not very tall is said to be of short stature. The stage is a child development are now on the milestones. A child who is beginning develop sexually has been reached puberty. Why the common English name for each disease using your medical knowledge? Enlarged private glands, mumps, difficulty opening the mouth, lockjaw, rash of a laryngeal, rash on an laryngeal posterior occipital nerve, German measles, paroxysmal cough with thermometer, whooping cough, Populus and vesicles first on trunk, chicken pox, cough, a cold following by rash, measles, sore throat and rash, scarlet fever, swollen joints and hair murmurs, rheumatic fever, fever following by muscle weakness, polio, cough with a cerebral cold.